Now we want to introduce our next guest speaker, Kristen Whitney Daniels. She is the chapter leader for T1 International's Connecticut Insulin for All chapter, a grassroots volunteer-led group that advocates for affordable and equitable access to insulin and diabetes-related supplies. Her testimonies have been featured at the Connecticut State Capitol and the U.S. Senate floor. In 2020, she attended the Presidential State of the Union as a guest of U.S. Congresswoman Rosa DeLauro. At her full-time job, she's the assistant director of a national nonprofit that focuses on justice issues and works for their NGO at the UN in New York City. So Kristen will be talking about, amongst other things, how the CT insulin bill passed last year due to CT Insulin for All's effort, and how to phone bank legislators as a way for outreach and as a way for the bill being considered in the state legislature. Kristen, we're so excited to have you.
Thanks. I'm so excited to be here. Let me just get my presentation up real quick. That introduction pretty much said it all. But just to give you like a little bit of background about how I got started in all of this, I am a type 1 diabetic, and I have been for 15 years. I also have a bevy of other autoimmune issues that have really opened my eyes in terms of medical expenses and kind of like the egregiousness of our medical system. And I have my own experience of rationing insulin. And so I found this community from T1 International about these groups that were speaking out about this issue that I didn't understand other people were going through. So it was really helpful for me to not only put a term to what I had gone through, but to find a community that was supportive and fighting for change. So our chapter is actually part of a much larger network. T1 International is a global nonprofit that was organized in 2013, and it's basically a commitment to advocating for people with type 1 diabetes around the world, just under the understanding that everyone with type 1 diabetes, no matter where they live, should have equal and equitable access to everything they need to survive. And that is insulin, that is diabetes-related supplies, including test strips, and being able to access healthcare. And so there are 37 chapters across the US, and it's an entirely grassroots effort. So this started from a very international standpoint, but when the insulin problem kind of blew up in the United States in terms of media attention, these states started building this network of chapters. And so we are not only geared to people with type 1 diabetes, but all people with type 1. There are at least 7 different types out there that people don't understand are part of that network. And so anybody who needs insulin and our allies are all invited in on this. And so what I initially appreciated about this, and what drew me to Insulin for All, is the fact that we are entirely grassroots and a volunteer-led chapter. So we have some staff at the national level, but for the chapters, we spend really no money on legislation. And at the national level, we refuse to take any funds from insulin manufacturers, insurance companies, or anyone who could potentially influence our voice, which is something very different for patient advocacy organizations. I just wanted to give, this chart kind of says it all in terms of like why we are advocating for this. So we are centering about a very specific issue. Our legislative efforts have kind of expanded since then, but so since around 1996, the price of insulin was about $21. When I was diagnosed in 2005, it was a little bit more substantial. But by the time 2016 rolled around, the average cost, we did a study with Senator Blumenthal in Connecticut, ranged from $290 to over $400 per single vial of insulin. And for reference, I required 4 vials of insulin a month. And so this is a 1,200% change in the price and far exceeds even some of like the most expensive products that have experienced inflation. And this has obviously contributed to just a huge issue in terms of people being able to access their medications. We know this isn't diabetic specific. This is medication specific for all around. And Yale University did a study a few years ago now that found that 1 in 4 diabetics are rationing their insulin. And we expect that with the pandemic, that has gotten even worse. Some studies have gone up to 50%. And I think you could probably find some similarities in terms of messaging between Medicare for all and our insulin for all sort of messaging and issues that we find. So one of the things that we keep getting told are solutions that are out there that really aren't patient-centric. These are really solutions that are touted by manufacturers and touted by people who just really don't understand the system. So one of them is patient assistance programs. They only help a small amount of people. They require a lot of paperwork, a lot of hoops to jump through, and there's no transparency whatsoever. And they can end at any time. When I was rationing insulin, I was literally on my last drops. I had no more insulin left, and I called the patient assistance program, and they essentially said, "We can't help you." And I was like, "I'm going to die in 24 hours if I do not get my insulin." And they're like, "Sorry, go to a hospital." I'm like, "I already don't have money to buy my insulin, like go to a hospital." So that's kind of the response that a lot of people get. We also hear a lot about Walmart insulins, which is a fascinating look. It's older insulin. I've been on it. It's volatile. It requires a very specific regimen and a very specific care. So if you're already rationing insulin, you likely can't pay to afford to see your doctor, who you would need to keep a very close eye on you. It's also creating a two-tiered system where rich people are able to access insulin, or people with sufficient healthcare plans, and then the poor get this dangerous insulin that we frequently call dead in bed because it's contributed to so many people with diabetes deaths. So our chapter specifically, we started in January 2019, and we held our first in-person meeting in March 2019. And one of the things that I really love about our group is we've built this up to be a community. It is not only that we are advocating for insulin and for better healthcare for folks, but we also want to make sure this is a community we can lean on, which has been so important during the pandemic. We started having weekly meetings when the pandemic first hit. As you probably know, people with diabetes are some of the most at-risk population for COVID complications. So, not that the fear isn't there now, but I think you can remember when it first hit, there's just so much misinformation and fear, and we really leaned on each other during that time and continue to lean on each other. We've continued to host monthly meetings since that first in-person meeting. And that's been from everything to develop advocacy skills, how to talk with legislators, actually having legislators visit, and build community. This is actually a picture from us doing something called the Gold Vial Project, in which we painted vials of insulin gold to say that insulin is worth gold to us, but it shouldn't cost as much. And so we've been giving it to legislators to kind of remember us when they go for votes. We've had Q&As with Representative Joe Courtney, State Senator Matt Lesser, State Representative Sean Scanlon. And even though our purpose has always been to create change in the state of Connecticut, we knew that it would always be an uphill battle. So the lead up to legislation, I think, is just as important as the legislative process itself, because sometimes when the bill gets passed, I found a lot of it is out of your control and is important to remember. And so one of the really important things is we just spoke to everybody we could talk to. I mean, I seriously mean everyone. We have this number 20 is probably very low right now. But we spoke to a lot of state and federal legislators to promote insulin for all. We outreached with many different organizations within Connecticut to tell our story, but also to see how we could support each other. Prior to the legislation, we had 34 media stories featuring our members and or our chapter. We spoke at 3 national press conferences. You can see 3 of our members right here. It was Senator Blumenthal. This was in July 2019. And then this is actually how I met Holly way back, was we participated in roundtables and town halls. So I met Holly at an event with Senator Chris Murphy. And that has been integral, is really building relationships with legislators who are passionate about the issue you're talking about, and also building relationships with media. We've gotten to the point now where we can go to certain outlets and say, hey, we have a story. Is there a way that you can pitch this or get this in? Telling our story telling our story and knowing how to tell your story is just so important. One of the other things we noticed in the lead up to legislation is that there are 3 manufacturers who produce 90% of the insulin in the entire world. So one of the issues into why we have such a problem with insulin. So Eli Lilly, Sanofi, and Novo Nordisk significantly increased their lobbying leading up to this legislation, knowing that we were already talking to legislators. So way before we even had a bill, they were already starting to wine and dine legislators, bringing them in to have conversations and lunches about their patient assistance programs and all the other ways that they help people with diabetes. I wanted to point out this sheet. This is actually not mine. This is from the cga.ct.gov website. I can drop the link later, but it's how a bill becomes a law in Connecticut. It kind of steps you through the processes. I don't have enough time to go through all of it because it can often be, it has nice arrows, but it often kind of loops around. So I will just be focusing on how our legislation went from beginning to end, essentially. So SB1/HB 5175 is an act concerning diabetes and high deductible health plans, and that was introduced at the 2020 legislative session. And it became, by being SB1, it was touted as the Democrats' #1 priority. And a lot of that is really owed to our members who continued to reach out to their legislators to draw attention, and also a perfect storm of media. We really capitalized on the fact that this was such an issue in the media, and honestly, it's sort of the poster child for everything going wrong within the medical community. And it was introduced in January, and I'm going to talk about some of the issues because I think that's important. Some of the messaging got beyond us. So when a bill is submitted, we didn't know what the language would look like. One of the things we were really intent on is we wanted to help people who were underinsured or uninsured. And the way that the bill originally got written, they put placeholder language in often. And a certain subset of our legislature took that messaging and said that we were going to tax diabetics, which is ridiculous because that is just political murder right there, especially with this media attention. And so we worked so hard to combat those talking points because people in the diabetic community were like, great, another tax on people with diabetes. Is it just people with diabetes? And it was wild because, the only thing we're trying to do is help people. It was more formally announced at the end of January, in which case the Democrats had to kind of rework their messaging. And that meant that this help for uninsured ended up being impeded quite a bit. We had very little notice on hearings, but we were able to kind of get a 2 weeks notice so that we could mobilize our members. And we submitted over 70 written testimonies, and 20 plus people testified in a public hearing. These were all our members. We had additional people, legislators, who all spoke out in support of this bill. I point out these points because this is what the bill originally looked like. I will get to the final passed version of the bill, but as you can see, it's $50 a month, and then there's an Explorer assistance for uninsured. Both of those got changed in the final iteration. So as you know, we had a pandemic hit, which kind of derailed everything. Rightfully so. And so all the bills that, despite us moving out of the Insurance and Real Estate Committee, which is where our bill was sort of housed and sponsored by Representative Scanlon and Senator Lesser, despite it making out and going to the House for a vote, and we never were able to get that far. And so during this time, we were really talking about how do we talk about the issues affecting our community and continue to say that we need help, especially during a pandemic, to access our insulin. So we created this idea around phone banking. And one of the important things was we created a goal and we created an ask. You kind of need a call to action to think of what that is. So we also got wind that there was going to be a special session possibly happening in the summer and possibly happening in September. And we were specifically told that we might have a chance that our bill would go in September, but definitely not July. It would just, they were going to focus on the coronavirus, which we all know how that happened. But that was essentially what we were told. So we created a team of people. It wasn't just our leadership team. It was a group of members who were really committed to getting the story out there. And we kind of divvied up responsibilities, like a fact sheet. We had a phone script. We made a social media campaign, and then we had people sign up using, just a Google form. And through the month of May, we introduced this to our members, asked people to sign up. And then we kind of had like a rally beforehand, and this is all virtual, of course, to encourage people. People could ask questions. We did like a little bit of role playing about how a phone call could potentially go. And from there on, we did about a week, 2 weeks of phone banking, and then we did a debrief after. And through the support of almost 30 members, we were able to cover nearly 75% of the state. I will say that not everybody was amenable to the idea, and some people had some serious issues, but everybody was really willing to listen. And despite us having this like SB1 designation, and despite having a lot of media attention, so many legislators did not know anything about this bill and anything about the issue. So I think it's important to always remember that there are a lot of people, as much as you think people know about it, a lot of people don't. So despite being told that we were not going to be put in the July session, we were. And that was largely, I believe, because of the phone bank, because these legislators started calling their, like the heads of their caucuses and saying, we need this bill, and started talking about it. Getting legislators talking about it was so important. As you can see, the caps were actually lowered, and a 340B study / Medicaid waiver was added instead of help for uninsured and underinsured. This happened very quickly. We had to mobilize very quickly. We did a second round of hearings virtually, which was awkward, but we did it. And then we got final notice before the House vote on what the bill would actually look like. And just to say, that's not always what you ask for, and it's not always what you look for. There's a lot of behind the scenes negotiations. So at the end of July, it went to a House vote. It's kind of unprecedented for a bill to pass on its first go around. Usually the bills take a couple cycles to pass. There was a lot of debate, but despite all of that, the House voted 142 yes, 4 no, and there were 5 people absent. It moved to the Senate. There was one particularly interesting person who stood up and held court for a very long time, calling us communist and socialist and all this other stuff. It was long, it was ranty, but in the end, it passed 35-1. One of the things that changed at the very last minute was that this bill did not go, only one provision went into effect January 2021, and that was a provision, and this helps people, so feel free to share this knowledge, is that anybody who has a diabetic and has insulin or other diabetes related supplies, if their prescription runs out or if they can't get in contact with their doctor, they can get an emergency supply once a year. And then unfortunately, the copay caps won't go in effect till January 2022, which is really unfortunate. The governor signed the bill in August 2020. And yeah, that was essentially how we moved through it. There's some more issues with 340B that I could talk about for a long time. But just to say, it's very important to keep a close eye on the bill. Every time it gets proposed, go through that with a fine tooth comb. Every single legislator counts, but it's really important to know what committee you would be going through and then who the heads of those committees are. Become really familiar with the CGA, the Connecticut General Assembly website. We are constantly checking that. They update that much more quickly than sometimes constituents, and just share your stories. This is our contact information, but I am super happy to take any questions, and I can also drop this info in the chat. That might be a little bit easier so you can see my face while I'm taking questions. But thank you so much. I really appreciate being able to talk about all this.